Are you ready to go all in?
Let's do this.
And welcome to the All In Practice Growth Podcast. I'm your host, Shane McElroy, and thank you so much for joining us today. Now, remember, this is the podcast that gives you a different perspective on the dental and medical industries. And it's really cool today because I am filming this live in an office in my hometown of Peachtree City. In fact, we are in Peachtree Pediatric Dentistry right now. We'll talk a little bit about where we're filming, which is a really cool theme, which is like movies. And we'll talk about why that is, how a pediatric dentistry office runs, how you create a partnership with multiple dentists in a practice. But what I'm really interested in is to find out who is crazy enough to actually want to be a children's dentist. Now, while I love kids, they are a lot to handle, especially getting their mouth. So let's meet Peachtree Pediatric Dentistry's two dentists. We have Dr. Kiersten Pannell and Dr. Eric Mobley. Welcome to the All In Practice Growth Podcast.
Hey, man. Thanks for having us on.
Well, yes, thank you so much.
Thanks for having me in your practice, right?
Of course.
So why don't you tell everybody a little bit about yourself? Let's start with you, Kiersten. Okay. Like where you're from, how long you've been practicing, all of that.
All right. So my name is Dr. Kiersten Pannell. I am a pediatric dentist here at Peachtree Pediatric Dentistry. I have been with this office for 5 years since I finished my residency program at the University of Florida. Go Gators.
Go Dogs. All right. Sorry to interrupt. Go ahead.
I know, it's controversial around here. So I actually grew up here in Peachtree City. I graduated from Starsmill High School in 2010, as well as my husband.
Boo, I went to McIntosh. There are rivals. I mean, seriously, come on now.
Tons of rivalries going on here. Went away for schooling and came back to be close to our family and because we love Peachtree City.
Yeah, it's not a bad place to be. That's why we moved back.
Exactly.
It's a wonderful spot.
And Dr. Mobley, tell everybody a little about yourself.
I'm Eric Mobley, pediatric dentist here at Peachtree Pediatric Dentistry. I've been here for 25 years now. I grew up in southern Ohio, a little town called Carlisle, in the middle of a bunch of cornfields. Went to dental school in Kentucky, and then pediatrics at Cincinnati at Children's Hospital there.
So, all right, you guys heard me just a second ago saying, like, who's crazy enough to work with kids right now? I know you guys pretty well. You're certainly not crazy. You are amazing with kids. But I'd like you both to answer this because I know we talked about this too. Your friends who are dentists or dental specialists also think you're a bit crazy for wanting to do this. Mm-hmm. So why on earth did you guys choose to work with kids? And why, where most people think of like they're screaming, freaking out, why is that like your passion?
I think I was born for it. I from the time of working with children my whole life, it's just natural for me and something that I've always gravitated toward as a dentist and from the very beginning. And I wouldn't trade it. It's just been a blessing to be able to work with kids for my life.
Well, I want to ask a follow-up question here. You're 6 feet 7 inches tall, right? So everybody, yeah. I'm 5. I tell people 5'7". I'm probably 5'6" now. As I've shrunken as I've gotten older. But you don't really think of a pediatric dentist being literally a giant, especially compared to those kids. So, like,
yes.
Was that a barrier at first? Or do kids get freaked out, or do they think it's cool?
I think it's been cool. I don't think kids, I'm usually sitting most of the time. Sometimes I walk up and they're just like amazed, like, what the heck's going on here? But other guys will kind of just look at you and be like, hey, man, you're cool. It's all good. Yeah. And then the young guys like, did you play basketball? They wanted to.
Of course, yeah, like anybody tall. And did you play basketball?
I did. I got to play in college and stuff. So
really good fun. For you. They didn't want me on the squad. I tried.
Really?
I know. I don't
Surprising.
know why. I mean, I couldn't. I didn't have an outside jumper. I wasn't that fast. It was okay quick, but I don't know. I don't know why you wouldn't want me to college team. Where'd you play?
So I played at West Point for 2 years, and then I played at a little school called Transylvania in Lexington, Kentucky for 2 more years.
And what position did you play?
I was like a big guard, small forward, somewhere.
Oh,
there.
nice. Yeah. So you're like the first LeBron James or Magic Johnson, like the point forward.
I was a weird person. I was for sure. I was junior. Right before my junior year, I grew 7 inches from 6 foot to 6'7". So I was a point guard going into that, and then I just kept some of my skills from being a point guard and just translated them out. Kind of. It helped.
No, you weren't weird. You were ahead of your time.
Yeah, absolutely. Yes.
All right, Dr. Pannell, how about you? What makes you so crazy enough to work with kids?
Well, I love children. I was between a few different occupations when I was thinking about dentistry, and one of that was a teacher. But I think the cool thing about pediatric dentistry is I kind of can combine those two. I get to do the dentistry part, but I also get to teach. I get to behavior manage. I get to shape these kids' lives, which I love. And in dental school, you start out dental school and you don't treat kids.
No, you treat
for the majority of dental school. And I'll be honest, I didn't love dental school. I thought, okay, maybe I shouldn't do this. But what I didn't like, and I love adults, I love our parents, but I did not like treating adults.
Why?
I guess I don't like permanent teeth that much. I like baby teeth. I like the dentistry that goes into working on primary teeth. And so when I went down to the pediatric clinic on my rotations, I just knew it was like a light bulb clicked in my head, like, okay, I do want to be a dentist, but this is the specialty that I want to go into. And so it kind of encompasses all that I want to do.
That's awesome.
I think it's like you're born to
I think you have to be, because again, we'll talk. We got to do some filming. It's a really cool and you guys saw me. Like I'm basically just a average sized kid, just an old kid. But I love working with kids. But it's a whole different thing when they're freaking out or things like that. Now, just to give you guys some praise, both my boys go here. Both my boys had like different situations. For instance, my youngest, Ethan, he was absolutely terrified of the dentist, and not the dentist, just doctors in general. 2 weeks before his first appointment here, he was like 3 years old. He had surgery, and they had to give him lots of shots and IVs and things like that. And so he was so terrified of needles, as many kids are, and adults. But he was that kid that you would think of like kicking, screaming in the chair. They're gonna kill me. They're gonna torture me. And as a parent, like, I'm more patient with other people's kids, like for sure. I'm more forgiving of that. But like, how embarrassed I was just sitting there, like, I can't believe my kid's doing this. Like, I'm in the dental industry. Like, how embarrassing is this? Yeah. But your team and you guys were so patient, so calm. Like, let him play with the instruments. Here, you can use them on us, right? Like, it was the coolest thing and the best interaction. That when he left, he's like, "When do we get to come back?" And I was half annoyed by the question. He was like, "Dude, you just stressed me out, man." But the beauty of that is every other doctor's appointment, you did them a solid and me, because he's not afraid of any doctor anymore because you guys were so nice to him.
See, that's so gratifying. And to see a guy grow up, and that's the challenge for us, but it's also hits you right in the heart when you can really turn a guy around from being super anxious to being totally cool. And that's the best.
Well, you guys got to see him. He's pretty cool now.
He does great now.
Yeah. And then there's Wyatt, who was playing when he was like 3.5, 3. And again, my boys have both cracked their teeth or fallen, and I haven't been there when it's happened. Not that I was absent. My wife was watching them for the time, so got you, Chi-Chi. Sorry. But,
you're calling her out.
But he cracked about a third of his tooth out, and we weren't sure if it was savable or not. Kind of nervous, like, and then Eric, we called you. You saw him right away. I think you came or stayed after hours, and we discussed it. The tooth wasn't savable. And my sister, when she was 6, almost died. She had malignant hypothermia, so she had a seizure right before they were about to open up for hernia surgery back then. So I've always been paranoid of anesthesia because of that situation.
Sure.
And so I was really nervous. And honestly, you took me through it. Tell about what you guys did with anesthesia here with kids, because that's got to be a concern for like many parents.
It is, and we love the fact that we have top of the world pediatric anesthesiologists that come in for us every other Thursday of our lives, and it's been a normal part of our lives now. And what a difference it makes for kids to be able to take a nap in a really difficult situation, to make it pleasant, make the going to sleep really nice. And you can't ask for a better environment to get in, get help, get healthy, but also have a positive experience. It's huge.
Now, I'm going to ask you this follow-up question because I already know the answer to it. So Wyatt wasn't scared at all. How do you guys calm down parents of this situation? Because you've got to have a lot of paranoid parents, right?
There are a lot of paranoid parents. You'd be surprised.
I think that's the hardest part of our job, honestly. The dentistry and working with children, we got that. But handling parents and their own anxieties and their own worries and trying to get to them with empathy. And I think it helps, too, that we're both parents. And so we can come from that angle. Like, we understand what you're going through. And I'm going to treat your child, and I say this to almost every single parent, especially parents of the children that I'm sedating. I would not do anything on your child that I wouldn't do on my own. And I know Eric goes through with the same exact empathy for every appointment.
I love having also the challenge of taking a very anxious parent and putting them at ease to say,
Definitely a bigger
you're
challenge,
fine.
right?
Uh-huh.
Oh yeah, for sure.
Because kids are going to be honest with you, right?
Yeah.
Mm-hmm.
So is this part of the reason, like, maybe you prefer kids? Because they're going to tell you the truth, right? Like, which is good. Like,
Yeah,
give
I
me
love
the
that.
news. I don't care if it's good or bad. I just do what's up.
100%.
Whereas adults, like, you've been flossing, right? Like, you guys know. And they'd be like, oh, yeah, definitely twice a day, once a year, right? Like, do you find that kids, like, can you guys think of anything like kids have said that's been like off the wall, stuff like that?
When they call out their parents, it is funny.
They
Like,
will.
well, mom gives me juice all the time, and the mom's sitting there and like,
Deer in headlights in the corner.
because they'll tell us the truth.
Oh, yeah.
yeah.
And that's the best. I love it when those guys they'll call out their parents. And they do it all the time.
Oh, that's awesome.
It's so funny.
I
You
need
could
to
see
set
the
up a
parent, like,
camera and a
shriveling.
mic in there and then a close up zoom on the parent's
And
face.
the parent
and
gets
that's it.
so small.
Yes.
Lie to them. You lie to them for your mom.
Yes.
So all right. So I'm an average clueless dad. What do you do with a dad who doesn't know anything, right? Because I would like, listen, the reality is in my house, you ask me, did they do this? Did they do this? Are they taking these medications? Be like, I don't know. I don't even know what grade they're in. I just know what school they get to.
That's so true. They really don't. Most guys, they come in, here's what I'm supposed to do. I'm supposed to bring them and if you need to call home to talk to mom about all this stuff, that's okay too.
100%.
So a lot of dads are like, no, I'm good. I'm doing my job. Let me out after this, and then we'll take care of it later.
Well, thank you guys for never making me or my wife feel guilty about not knowing or this or that. You guys do a great job here. And by the way, your team is ridiculous. Like, they're so kind and nice, and not just to
Thank you.
me, to literally everybody I've ever met. And so says your thousands of reviews of 5-star, which I've never seen, like, genuinely all 5-star reviews. That's pretty impressive. Well done.
Well, thank
Thanks.
you.
We try, and the girls that work here, they're fabulous ladies and been here forever, and they're loving souls, and most all are mothers and care and have cared for many years, and they know their jobs, and they know how to make a kid feel more comfortable. They know, they've been there, they've seen it all.
Oh, yeah.
And that's a big difference maker.
And I think too, part of that. So I was a patient here, and
that's so cool.
and I assisted
So you
here
grew up,
growing up.
You grew up in Peachtree City just like me. We ended up coming back, right?
Yes.
Now take me to the story of your, like, how long were you a patient there too?
I became a patient here in about 2000. And so I was a patient here up until, I've never really had any other dentist other than my dental school friends.
Sure.
But the cool thing is, and I worked here over the summers and I shadowed here, but some of the same staff who were here when I was shadowing, when I was assisting, they're still here, which I think attests to the practice and how close-knit of a family we are and how hard we all work as a team to still have some of the same people who saw me grow up in this practice.
So you're becoming a partner of the practice now, right?
Yes.
Congratulations. That's cool. I want to get into that a little bit more now. So technically, you're the boss lady now too. So what is that dynamic of being a patient of the practice, right? So you're a child of the practice, growing up within the practice, and now you're the boss.
Actually, some of the staff was joking the other day. They're like, when she was a very young girl, we told her, someday you're going to be our boss.
Oh, no way.
They even said that.
They said that.
And they could see, because she has such determination to do whatever she needs to do and they like, no, you're really going to make this happen, and someday you're going to be our boss.
So not only are they amazing at their job, but they also can see the future.
Yes. And I think, so Eric and Barry Markham, who was the founding owner of this practice, they set me up for success because they sat down with the staff before I came in and they all explained to them that I'm no longer Kiersten. That's what they called me for years.
Oh, yeah.
Kiersten.
That's her name.
And so they said, her name is Dr. Pannell, and that is what she is going by.
So they kind of did that for you.
They set me up, I would say, for great success in the area of drawing that line from, because I was friends with them.
Of course.
When I was assisting here, when I was shadowing here, I'd spend time with them outside of the office, and we still do spend time as an office.
Yeah.
But having that line drawn between I'm no longer just a friend And I consider myself a friend with everybody.
Of course.
But I am Dr. Pannell now.
Yes.
And so that really set me up for success, and I think has been a great thing moving forward that nobody ever calls me Kiersten. I go by Dr. Pannell.
The transition was, I was a little worried at first because she's such a lovable person, and
Sure.
I'd been here forever. But the ladies here kind of, when we sat down, we said that, no, this is the day, and it's going to switch over today, and you're never going back, because she's going to be
You need
ultimately.
like a swear jar.
Yes.
If they don't say Dr. Pannell.
Yes.
Yes. But they all took it to heart, and they really have lived by that from that day forward, and really brought that respect, because she deserves every bit of it. And I love that, and I love the way they transitioned in that, because it would have been easy for them to kind of like,
Of course.
Yes.
Yeah,
And
because
even-
they I'm sure it's like when a parent sees their child who's 40 years old, like my mom, I'm still a kid to her.
Yes.
Because she saw me since the day I was born.
absolutely, yeah.
And even I'll see them at the gym or see them out, and I was at the gym working out one day, and then I hear Dr. Pannell, and it's my staff. So my hygienist, and she was laughing because another girl was like, "You called her Dr. Pannell outside of the office?" And she's like, "Yeah,
Good,
she's
they
Dr.
trained her.
Pannell." And I
Yeah.
said, I don't demand that. I don't feel
course.
like I'm entitled and need to be
Sure.
called Dr. Pannell all the time. But it is nice that we have that line and they respect that and understand that.
100%. Now, I will say there's an interesting dynamic between the two. And after I say this, I'd like to get into like, how does it work becoming a partner in the practice, right? So Dr. Mobley, you became a partner with Dr. Markham, right? And now you're kind of taking that same role just years later. But you're 6'7", and how tall are you, Kiersten?
I'm 5'1".
You're 5'1". Okay. So we'll talk more about kind of the video shoots that we did with you guys, because we had a lot of fun and taking pictures. But it was really tough on Dahlia, who's amazing videographer, photographer that we have, because how do you get those angles when you have to go high and
Right.
low at the same time? Do people ever is that ever weird? You guys being so tall or short?
I think we have to adjust. I have to adjust the chair. Like we adjust the
Yeah.
chair so it suits you. But that's really it. That's the only
Right.
little small thing.
Now I want to ask a real question to you, right?
Yes.
How old are you, if you don't mind?
I'm 33.
Okay, you're 33. You look young. I know that pain. I looked like I was 12 till I was
Yes.
31. And what happened then? I had kids, right? And so then I aged, and I look my age. But being 5'1", he's 6'7". I'm assuming he's the doctor, and he's a man, right? Does that ever happen to you? You're like, who are you, right?
Yes, it does. And so I try, first off, all the ladies wear the same color, and I try to wear a different color than them just because I need to stand out a little bit.
Sure.
If I walked in navy scrubs and they all have navy scrubs, they're going to assume that I'm a hygienist or an assistant.
Yep.
So I try to wear something different, but I always walk into the room unless they know me well.
Yes.
I say, hey, I'll look at the patient.
Dr.
I'm the
Pannell.
doctor, Dr. Pannell. You got the short lady today, not the tall man. And that seems to go pretty well. And now that I've been here for 5 years, unless it's a new patient, most people now know that I am the dentist.
100%. Now, my assumption is that with kids, though, that seeing you, young, smaller like them, right? That is actually an advantage probably with kids. They're not intimidated by that, right? Now, for you, has that ever been a challenge where kids like,
It's really not. Like from the day I got into pediatric residency, it's never been an issue. And I've had 100 people asking me that same, how you're so big, man, that's amazing. Or do you scare these kids away? It's just never been. I think it's your attitude going into you walk into that room and you walk in as their friend and friendly and outgoing and you relate to them. They don't care. They don't care a bit about how big you are, small you are. They just want a person they can relate to.
well, is this something you guys think about? Because what I have really noticed about your practice is that you guys really talk to the kid probably more than the parent, right? So, I mean, the first pediatric dentist I ever went to in Johns Creek, they talked to me, they ignored my kid, right? And it just felt weird. Like, but that was the first thing I ever noticed. It's like you sat there and explained to them, answered their ridiculous questions in a serious way, like in a nice, kind way. And you took all the time that they needed, and then you addressed me and explained to me. And
Absolutely.
I'll
They
be
want to know.
honest, I understood more when you explained to them because I'm like, I can speak on those terms.
Right.
They want to know that they're heard. They really do.
Yes.
And like, oh, he gets it. He listens to me. That's huge for that child to know, okay, I can trust this guy. He listens to me. So if you never take the time to actually sit and physically talk to them and relate to them, they don't get that feeling. It's important.
No, 100%. Okay, so let's kind of take that turn now and talk about the business side of this, right? So where are you guys at in your process of you becoming a partner? And is that like a 50-50 thing? Is it like a 20-80 thing? Like, how does that work?
Yeah, so we're 50-50. That's our plan, and we're in the process right now. I've reached out to, banks for the loan, and we are in the process of having the practice evaluated.
So
you do evaluation first,
Yep.
obviously.
Yes.
a great company, they come in and they just look at every aspect of it and then evaluate it and then
Who
tell
is
us.
it? Give them a plug.
McGill and Hill.
McGill and Hill. They're a fabulous company, and they've been doing this forever and well known throughout the dental industry for sure.
Perfect. So a little bit, probably a different scenario, because when you're going to go into business with somebody, that's a huge decision, right? I've done it. I've done it more than once, and I've made mistakes doing it, right, without vetting it out. You guys have an interesting dynamic, right? You guys have a very many years of a relationship, knowing all that. So Dr. Mobley, would you consider partnering with anybody you didn't know that well? Like, how does that work?
Well, I was so blessed to have a partner of 21 years, and Barry Markham and I were. It was really lucky to have such a wonderful, moral, hardworking partner, and then to be blessed to have this wonderful person beside me to be my next partner. It's just such an incredible combination. I'm the luckiest person in the world to have these two people into my life and to be a part of my life. And as we were saying the other day, I was talking to Kiersten, we see each other as much as we do our spouses easily.
100%.
Yeah.
So my business partner, Blake McClellan, used to be I call him my life partner, right? I have my wife, right? But my life partner, right? Because you do see each other all the time and you have to communicate all the time. And it's more than just working on the kids, it's running a business as well. So was that always your plan?
That was my hope, and something that I
So
had.
that was her plan. Then she was planning this from the beginning.
That's awesome.
Well, and from the beginning, I've loved growing up here, and so I knew I wanted to come back and be close to my parents. I'm a homebody, and this practice, I mean, your boys know, it's a wonderful practice.
It's
so
like a landmark here now too, because you had Dr. Markham. So how long has the practice been around?
30 years, yeah.
So 30 years, and now it's transitioned from Dr. Markham, Dr. Mobley, and now you're going to be kind of the future going forward.
For sure.
Yes, and that's the hope. And so, I feel very, very fortunate that it all played out in the way it did, and that I'm going to be a partial owner of this place. I mean, it's truly dreams come true, and I feel so fortunate that I came in to Eric, because things would have been way different if it wasn't.
Sure.
So I feel very, very fortunate and blessed for that.
That's
Well,
awesome.
you don't get two kind people. That's what you want in a business partner. Somebody who's
Right.
they don't have to be funny or lighthearted all the time, but they have being kind in general, because that's how they're going to work in the business world as they work at their personal life. And finding and creating good partnerships is one of the most difficult things. And it's the probably biggest thing that prevents businesses from continuing or moving forward or being successful.
I've had dozens of bankers, insurance people, everyone in the world saying, your 21 years as a partner with Barry Markham was a miracle. We don't see that in the world. And I'm like, well, to us, it was very natural. It was normal, and it wasn't difficult at all. It was actually quite nice to have somebody that you can share a call with, share interests with, share your concerns with. How do we approach this? What's the best way? What do you think about this? And share a case. Look at this picture. What do you think? What should we do here? And having that right there with you to kind of get two minds on everything like that.
100%.
It's a blessing, and in every way. So I've had that throughout my career, and it's been awesome. So I wouldn't trade it.
And kind of adding on that, I have some colleagues who they are partners or have other dentists in the office, and they have different offices. And they're like, oh, I love having my personal space, but we share an office. And I love that, because if I ever have a question, if he ever is like, hey, look at this x-ray, we're constantly throwing ideas off of each other. We're constantly working together, which I think is so big, because there's something new every day. Pediatric dentistry is not
100%.
every day the same. And we'll see x-rays and we're like, I've never seen this before. What do I do here? And so we always are bouncing ideas off of each other and coming up with treatment plans together. And so that's been huge for working together.
Patients win on that, like
Yes.
flat out.
Yeah.
They've got
Yes.
to.
Oh, no,
Because,
100%.
more minds you get on, and especially sharing it with a great mind like this one, you get better ideas, you get more ways to approach a problem. You
Two
just
doctors
win.
for the price of one. I mean, that's a
Exactly.
steal. Right?
Absolutely. It's
Exactly.
awesome.
But not just that. I mean, there's got to be something to this as well. Oh, no. Dahlia's over there just throwing stuff around. Unbelievable. No, I'm just kidding. So it's not just about, to me, though, the clinical side. Yeah, obviously that's the most important thing, right? Giving care. But you're a business owner, and owning a business is scary. So to have somebody to like, that stress alone, I've seen it. You guys have friends. You've seen it eat them up. And so is having let's talk about the business side real quick, that kind of backing or learning from each other, right? Because you've been doing this for how many years, Eric?
30 total. Yeah.
30 total. So how many years have you been doing this?
5.
So running a bit, it's different, right? So you're the boss. It's a
Yes.
whole different,
For sure.
different stressors, to
Yes.
deal with and things you have to learn and do. So is that another huge benefit of having a partnership?
100%. And to be able to share some of those duties is a blessing. And in every way, we try to our best to, Barry and I actually, all those years, we divided up certain chores, and he took some, I took some, and it took the weight off both of us as we went forward. And we just basically worked on our strengths. So what's the best thing you do in the business world, business
Love
side of
that.
this? Okay, I got all that. I take care of this. You do great with this. You do that, and it worked out beautifully.
By the way, I love that because I always say, like, I used to build, when I built my teams when I was at ZMV as a director, I always hired people who had strengths where I was weak. So a lot of people say, you should be well-rounded. I disagree. I think you should double down on strengths and cover your butt with somebody who's, wherever you're weak, with somebody who's 10x stronger than you in that area.
Right.
For sure.
Right.
Yeah.
And part of it too, one thing I love that we can work together on is, and we have wonderful staff members, but when you have a group of 18 women, problems, complications might arise. And so we don't have to deal with that alone.
For sure.
I don't have to deal with it alone. He doesn't have to deal with it alone. And we can sit down together and come up with solutions. It's not all on one person.
And we sit down with each other, like when we're sitting across from some young lady that has an issue, and I'll certainly approach it differently than Kiersten might. And so they get a different perspective from us as far as how we each feel, and we might get a better solution out of it.
Depending on what it is, Kiersten, you might have to really call them out while you're trying to be like, oh, I'm so sorry. You're like, she's full of it. She's full of it.
Never.
Never. That's never happened once. That's funny. Well, I want you guys to tell me about the theme of your office, because this is one of the coolest offices I've been in. When Dahlia came in, she's like, oh, I love it here. But tell everybody kind of what the theme is, how you have it, the decor, because my kids absolutely love it here.
So this all occurred 30 years ago when Barry first opened this place by himself, and they decided to go with this movie theme from the beginning. Now that was before the movie industry was here, and before all the craziness of Trilith and everything. So they were kind of ahead of their times a little bit. They didn't realize that movie industry would be so crazy here later on. But starting with the theater seating, and then we actually kind of built on it over time with the game room and the big screens everywhere and all that kind of stuff. So it's just kind of grown over time to become more and more involved.
I mean, how many kids' dentistry where you don't wait because there's no waiting room? You're watching movies, right? Like in a movie theater. And for some reason, what I noticed, so it's almost like this little psychology trick of like, you're not in a scary place. You're in a place that you know, right?
And you love,
Right.
and you're comfortable.
You're comfortable.
100%. And then I noticed you guys have a lot of new movie posters, but like in the frames that are at the theater. So like an extra level there. Like I love seeing these kind of things that I notice. And then, but like some of the old school movies, like I saw Willy Wonka and I'm like the old school version. I'm like, oh, no way. Like I'm a kid again.
Absolutely.
It's was that on purpose to have that kind of mix? Or was that just a happy accident?
I think it was a happy accident, honestly.
so.
And we change out all the posters and periodically and stuff like that for fun. But it's the movie itself, and the little girl comes in and sees Frozen on. She's done right there, and she's like, "I'm good. This is my place. I love it here."
100%.
Yes.
And not only that, as soon as they get in the chair, you got every chair has a TV on the ceiling. and you give them their sunglasses and their
And your
headphones.
headphones.
They're
and
set.
And they're not even worried about anything. You're like,
No.
Absolutely.
my kids didn't want to get out of the chair. Like, I need to watch the rest of this scene. I'm like, I'm pretty sure they have another kid that keeps coming here, bud.
The biggest thing is
Oh, good.
whatever instrument is in my hand, which normally they would be like, what's he?
Yeah.
They could care less. They're watching the show.
Just don't block the
They're really,
screen button.
exactly. Don't get your big noggin
Right.
in my way.
Oh, yeah. I'll
As
have
long as I
patients
keep
say
my head
that.
out of their way, they're good to
Yeah,
go.
exactly.
I can do whatever I need to do. They don't care about the instrument. They don't care about it's, and also the drill itself. If you have to do a tooth,
Sure.
the headphones, you're listening to the show. It's not anything like it was when we were kids, and you're just kind of sitting there, gripping the chair a little bit.
Yeah.
Yeah, for sure. So it's so much better in every way.
I'll walk up to kids sometimes and I'm walking in to do their exam. I'm like, hey, bud, what's up? No response. I'm like,
I'm busy.
hi.
Exactly.
No response. And I'm like,
Okay.
okay, all right.
I'll
It's
just
fine. I'm
I'll
just going to look in
okay,
your mouth.
okay.
It's okay.
That reminds me of one of the videos we did the other yesterday where it's like, why you smile, the elf thing, where it's
Yes.
like, why you smiling so
I love
much?
that
I
one.
love a smile. We have the kids say, what does he say there?
Make working your
Oh,
favorite.
yeah, like work your friends. So the kid's like telling you to work
Work
on
my
it
mouth.
Yes.
so that I can enjoy my movie right
Yes.
now, right? Yeah. Well, let's get into that, right? So we did a ton of filming yesterday and a little bit this morning, but the reason we're doing that is we're creating a lot of content to go on your social media channels. Why are you guys investing in that for your practice?
I think social media, it plays a huge factor for not only life right now, but for businesses, for people, and especially parents who are on their phones a lot or go to the internet to find resources.
Sure.
That's the first place you go now. You have a question about a tooth or dental related, or you need a reference, you're going to the internet.
100%.
So making our presence known on the internet, social media pages, websites is huge for us. And I think it's the future. And so if we can kind of get into that and make our online presence, digital marketing presence, social media presence known,
Yep.
I think it's going to be huge for the growth of our practice.
But they're also learning too. I mean, they're learning legit stuff now. We have some stuff we're putting out where they're learning real problems that real parents have, and they want to know the answer to, and they can go right in there and find out. And it's really cool. And I'm not sure there's a great place for them to where they can actually have a conversation or hear a conversation, or no, let's answer these questions
Yeah.
in plain talk, where you can just like anybody can like, no, let's talk about this.
And 30 to 60 seconds, so because I'm ADD and I can't watch past that, right?
Right.
Like,
Right.
I mean, honestly, we've had to curate content that way to meet people's attention span,
Mm-hmm.
but also either educate and make them laugh, inform them, whatever. But let me ask you both. What was your favorite thing to film over these last couple of days? And I want, each of you give your own answers.
My favorites are the TikTok videos.
Yeah.
For a few reasons. I think they're funny, they're fun, they're lighthearted. And I've had so many parents and patients, even friends who don't even live here, say, I love the TikTok videos you guys make. But then I feel like when you make them with your staff, it's almost team bonding in a way.
Yeah, for sure.
So some of the staff members get into it. You get to do funny things that you normally wouldn't do with your staff members. So I think it's cool on both ends.
100%. How about you, Eric?
I had little tiny Maverick,
He was so cute.
and the cutest kid you ever saw in your life, and is such a personality. And to do the little skit where he was in front of me and looking crazy up at the sky in front of me, and just amazed by my height, and then doing the whole 6'7" thing.
Oh my God. I got to
Oh my
say, I'm
gosh.
done with 6'7" though after this.
Me too.
We did.
I've been
Oh,
done
gosh.
with 6'7". You got
It's
3
too
kids at home?
Oh, yes.
you
Yeah.
hear it nonstop.
You're not done.
I get it at work. I get it at home, right?
It's everywhere.
everywhere.
And honestly, thank you guys for letting my kids be involved too. They
Love it.
had so much fun. And Dr. Pannell, I've got to apologize to you about my son Wyatt. So we set up this little game show, and not in a bad way. It was funny, but we had a game show where, and it was titled, "Does My Dentist Know Gen Alpha Slang?" Right? And Wyatt was the host in his little suit,
that's
and you were
awesome.
the contestant.
Yes.
And you would say a term, and it would be wrong, and he would come back with like a witty, smart aleck answer, and I'm
Oh my
sitting there like,
gosh.
he must have learned that from his mother because he certainly didn't get it from me.
He was quick on his feet with some of those comebacks. I loved it. I was impressed, honestly. At the end, he apologized.
Oh,
He was like, I didn't mean him. I was joking. I'm like, I know you were
Oh, no.
joking.
To be fair, you guys will say it was funny, but I'm sitting there being like, oh my God, he's not only does he look like a miniature version of me, he's a nerdy with quick wit. I'm like,
I love it.
He's going to be a problem.
Yes.
That's what he's going to be.
That's awesome.
And then we had Ethan, who all he wanted to do was the clapboard. He was like, I've always wanted to do this. My entire life, all I've wanted to do is clapboard. I'm like, we have like 2 of them at home, dude. You've never touched them once. But I thought it was like, we've done so many different shoots and things like that. I had so much fun with the kids, like making videos of the kids. That was my favorite part, like interacting with you two. And I do think the Maverick one, like, because you didn't get to see that one.
I didn't get to see it.
He was so excited to do it too. It was like the most adorable thing. And just the, whoa, because he genuinely, we're like, do that line. He forgot his line. He really went, whoa. He looked up. It was so fun. But thank you guys for being so amenable to do all these different things.
We've enjoyed
I had a
it.
blast. Oh yeah, and we're not done. We're going to do more of those for sure.
And the staff has enjoyed it too.
Yeah,
I really think so.
I had a really good time with them, and they were really up for pretty much anything, which is always makes things way easier.
Yes.
Right.
So we don't have a lot of time left, but I do want to go over. I'm going to each ask you a question. It was relative to. I wish I had known this. These are either questions I've asked you, or wish I would have known to ask you when it was happening. So, Kiersten, I want to start with you.
Okay.
So when my son Wyatt was born, we actually didn't sleep for the first 6 months. He was colicky. He literally woke up every 2 hours. We had to give him like specialized formula. He couldn't latch, struggling with breastfeeding. My wife, of course, like, and I know she doesn't mind me saying this, but like kind of got depressed from it because it's like this thing that like, I should be able to do this with my kid. And it didn't and it was a real struggle. Those first 6 months, like it was rough. And then when we were kind of getting ready to the shoot and things like that, we're talking about like different procedures we want to talk about. And you had mentioned the tongue tie release. Mm-hmm. Can you do everybody a solid? Because if this helps one parent who doesn't know about this, like you change their lives. I wish I had known. So tell everybody what tongue tie release, what it does, like who should pay attention for this kind of thing.
Yes. So, and ironically, my Wyatt, my oldest son, we went through the same exact thing. Yeah. And so I wish I would have had these resources when I was in that boat. So the dyad between mom and baby when you're nursing, it's very, very important. And it can either make or break the nursing experience and newbornhood when you're trying to figure things out. And so if something is not working right with that dyad, the whole thing is going to fall apart. Sure. And moms are going to think, and I hear this all the time, they think it's their fault. And so they end up with depression.
They always think it's their fault. And the dad's like, why?
Right. And they end up in this depressive state. And I had a mom once who, and she had circled, we do a questionnaire, and she had circled that she was dealing with postpartum depression at this point. And sorry, that's going to make me emotional. And so mama always says, you know, they can't latch. I can't latch. They talk about different anatomy, all this stuff. I don't produce milk. I hear that all the time. And it's not always their fault. And actually, a lot of times it's not their fault at all. And so it's important to know that oral structures in the mouth can alter how we nurse, and more specifically, the tongue and the frenum attachment underneath that tongue, the frenulum.
So what is that exactly? So the frenulum, it's that at the base of the tongue?
Yes. So it attaches the tongue to the floor of the mouth. And we all actually have that in utero. And naturally that is supposed to kind of reside and release. And then the tongue is free to move. But in every child, it doesn't always do that. So that's when we're born with the tongue tie. And so that can cause many issues, specifically with latching, with nursing, with getting adequate milk. And so then we end up with colic. We end up with gassiness, reflux.
Yes, and $8 a bottle of formula, which is probably 16 bottles.
Right.
It was a car payment for me just to get the right formula.
Yes, and so it ends up being a slew of issues. And a simple release of that tongue tie can instantly allow that mother and that baby to have that nursing dyad and have a positive nursing experience. And they actually can nurse. I have them nurse right after I do it.
Oh, no way.
Yes.
Okay, so I was going to ask you about what is that procedure? Because now you're going to freak parents out. Like, what a release? What are you going to snip that thing, cut it off? Like, what happens?
So the cool thing now is we use a CO2 laser.
Okay.
And so all we do is we numb the frenulum with a little bit of numbing jelly. We take the laser. It takes less than 1 minute. We give the baby to mom, and the mom can nurse.
So the baby's not in pain?
Like, no pain. Probably a little uncomfortable just from us holding the baby a little still, just for safety reasons.
Yeah, of course.
But then the baby goes to mom, and the baby's usually crying at that point. They've been separated from mom.
Sure.
Stranger is holding them, trying to use a laser on their tongue. but I give the baby right back to mom and they nurse immediately. And it helps a few things. It helps calm the baby down. That's my biggest thing. Yeah. And I usually ask them to come a little hungry so they're ready to eat. And I have never had a mom not tell me that it has changed immediately.
That's crazy. So, and for when you see those moms for the first time, being able to latch like immediately after and things like that, what happens emotionally to them?
I've had so many moms cry in my office. Yeah. And then I get emotional because I've been there.
Yeah.
And I wish I had this when I had my babies.
Yeah.
And so it's a very emotional experience.
100%.
Very emotional. I've had many moms cry. I've had grandmothers come in and cry. I've had dads like just so relieved that mom is relieved.
There it is.
Yes.
Yeah, I was about to say, it's not the baby, it's good for the baby,
Everybody.
but now my wife is like, doesn't feel guilty anymore or this or that.
Exactly.
So it's
I would say, we talked about how pediatric dentistry, we're shaping lives and we're changing dental anxieties. And it's so gratifying, but this is instant gratification.
That's awesome.
I mean, to see that change within 1 minute of treatment and see this mom so happy and a baby happy because they're actually getting milk.
Starving,
right. They're getting milk and it's a good latch and it's so gratifying. As a mom, as a provider, it's the best thing that I do.
Yeah, and it's funny because I don't think most people would think if they were struggling with that issue to actually go to a pediatric.
No.
It's like, why would they? Because they've never been before if it's their first kid. Like, I don't,
right.
All those things. So, hey, if your kid is having those issues, trouble latching, just not a good feeder, gas, all those things, go see a pediatric dentist. If you're in this area, definitely come see you too.
Yes,
for
of
sure.
course.
But to me, if you've ever been through that, it is the most stress. It is just, because you don't sleep either if the baby's not sleeping. It's just, it's a rough experience.
And the first few months of a baby's life are supposed to be beautiful. They're supposed to be pleasant. Of course, your baby's fussy. Of course, you're not going to sleep as much, but it should be a happy time in your life.
Is that one of your favorite things to do?
Oh, 100%.
Yeah, I figured as much.
Yes, well, my favorite thing.
That's really cool. Now, I don't have as much emotional. Oh, go ahead.
No, I wanted to tell you that the difference is for me, and I was skeptical coming into this.
Sure.
And I knew the research. I knew that you could make a big difference. And I'd seen some of the testimonials, and they were mind-blowing that you see from other people. So as we started to train in this, I was still a little, I had a whole career where we didn't do this. But I'm telling you, the first time you do one, and then the parent comes back and she's crying in gratitude and gives you a big hug and says, "Thank you. You changed a lot for me. You changed." And it hits you right in the heart. And you're like, wow, what a difference we made here. And it was super cool. Like even after doing your job for this long and to start doing this and making a difference in people's lives.
Oh, yeah. How rewarding is that? Right?
Oh, 100%.
Because to Kiersten's point, the immediate gratification for them is immediate gratification for you guys.
For sure.
Oh, yeah.
Because like teaching a kid how to brush their teeth right is great and when you see them in 40 years and you know what I mean? But like, you got to wait to make sure you did it right.
Sure.
So then, but like with that, it's right away. And that's always a really cool thing.
For sure.
And there's not a lot of probably things you guys get to do as much as that kind of.
Now, I can tell you take a child with incredibly decayed anterior teeth and you make beautiful composite crowns that are white. And I've also had many parents, you bring them back and they have this beautiful smile and they're like, "Oh my gosh, thank you so much." Or it really affected them.
Oh yeah.
And they thought, "Oh my," it hit their heart to have this child with these dark teeth. So that's instant gratification for sure. But honestly, with babies, it's even greater.
Well, it's just a baby because that's just a whole different thing.
Who doesn't love babies?
Oh yeah, you're not allowed to be my friend if you don't. Let me just pick that
Absolutely.
one, right? Kids and puppies, like, come on.
Right.
Yes.
Exactly.
All right, Eric, I got a couple. They're not as emotional, but that's for you. And I'm asking you these because I've asked you these via my children, right? So I want to talk. We'll do Wyatt's question first. So Wyatt's my oldest son, and really white baby teeth, but then he got some big permanent teeth coming in there, and they looked yellow, right? And super yellow compared to the white teeth. And I'm sure this is a billion kids. What causes that? Because he's like, "Can I whiten my teeth?" And I actually, I don't think so, dude. I was like, let me text Dr. Mobley real quick. Nope, not ready.
So I don't like for my guys to bleach too early due to sensitivities. But a lot of parents, and I've had literally hundreds of parents come at this very particular time when you have mixed dentition and some adult in front and babies in the back.
Yep.
And they see this contrast between the two. And it freaks out so many moms. I can't tell you.
Yeah, it really does.
And it really does. And they think that there's a serious problem here. Like something's wrong.
They're not brushing or like.
Yeah. So something's wrong. We're not doing well in this. And then you kind of walk them through that these permanent teeth have pigment. The baby teeth do not have that pigment. And there's the color difference, but it's a normal difference. And once the other teeth come in and they're all the same color, they'll look beautiful and healthy and wonderful. So it's not a worry. And you can try to let that one go. You got lots of worries. Let that one go for now. Now, there are some kids that have defects of their enamel and things like that, which we can repair on their permanent when they come in. But this is just a normal, as far as just having some pigment on your permanent teeth, that's normal. Yeah. And everybody goes through that little phase. And to just kind of chill out and let those other permanent teeth come in.
Everybody just chill out. You don't say that to the mom, right?
Sometimes, yeah.
Probably kindly.
You need to calm down.
Maybe
Right?
Never
not
say
like that.
Okay, so it's fine if you say it. If I say it to my wife. Okay, got it. So it's just a dynamic there. Okay.
Yes, that's your tone of voice.
Yeah. Last question I have that's relative to my kids. Again, I'm being selfish here, but I'm assuming you guys all have kids too or whatever.
For sure.
So my oldest Wyatt is 12. Now, he has not really crowding or anything like that, but he has an overbite, as you know. And we asked, is it time for Wyatt to see the orthodontist? You said no at the time before you get into this. Then we have Ethan, who's he's my 9-year-old, so he's younger. His teeth are a little bit crowded there, and he was having some other stuff going on. So, but you recommend for him to go to the orthodontist, and now he's got expanders, but he has braces some. So with Ethan being the younger one, why did you advise for him to get braces, but Wyatt to wait longer?
Yeah, everybody's different. And skeletal structure, tooth size, all these different factors weigh in and how your jaws relate. So cross bites, severe crowding. There are some reasons, certainly, to get early intervention. If we can wait, we'd love to wait and only do one phase. And most of my parents appreciate that we want to be conservative when we can. There are some cases, though, that really do benefit from early treatment. And that's just, that's the way it is. And for those guys, we will go ahead and get a referral going, get them to the orthodontist for some intervention, whether it be for expansion, for tiny palates, or early braces to help the jaws relate better. And so you develop better and you have a healthier mouth as you get older, and makes everything better for you as you grow up.
Well, by the way, you referred us to Dr. Mahaffey and Dr. Lucas here in Peachtree City. Thanks for that. Ethan already loves it over there, and they are taking.
They're wonderful.
Yeah. They're kind of the way they interact with patients reminds me of you guys. So it's kind of synced up there, and so that transition for him was a lot easier because of you guys. Awesome. So thanks for that referral. By the
Absolutely, they're wonderful people.
100%. Well, we're gonna wrap now, but guys, thank you so much for coming on, answering some of these questions. Hopefully, for some of the parents out there that helped with those answers. And again, wonderful practice, wonderful team. So thank you guys so much. I appreciate y'all.
Thank you so much.
Thank you. We loved it. We had a great time.
Awesome.
Yes.
All right, guys. We'll catch you on the next episode of the All In Practice Growth Podcast.
Thanks for listening to the All In Podcast. See you next time.